So we do find that COVID-19 vaccination is safe while you're trying to conceive. It doesn't affect your fertility adversely at all. So please get yourself vaccinated even before you get pregnant. For pregnant women as well, COVID-19 vaccination is totally safe in all gestations of your pregnancy. In fact, we find that women who are pregnant with COVID-19 infection, they may have no symptoms or mild symptoms just like everyone else, but we do find that they are more at risk of getting more severe symptoms or needing ventilatory support as well as ICU care when they are pregnant with COVID compared to non-pregnant women. So please go get yourselves vaccinated, complete your vaccination, and if you are eligible for a booster shot as well, you should go ahead with that. We do have couples coming in to see us in the fertility clinic, and they often feel like they are alone in facing the problem of subfertility, but that is not true at all. In fact, about 10 to 15% of couples, they do face the problem of subfertility. So as far as we know, this feeling is often perpetuated by the fact that you hear from your friends or your colleagues that they get pregnant within the first try or within the first 2 months of trying for a pregnancy. But we do know that only about 20% of couples are successful in getting pregnant in each menses cycle. And so this translates to about 80 to 85% of couples getting pregnant if they try having regular sexual intercourse, that is 2 to 3 times a week after a year of trying. So only 80 to 85% of couples are successful after a year, and another 50% will get successful after 2 years. So actually, subfertility is a lot more common than you think it is. Okay, so generally, ovulation strips can be used. They're quite expensive, I must say, and they may not tell you exactly when ovulation does occur. But I do understand for some couples, perhaps that, just having the idea of having sexual intercourse 2 to 3 times a week may be difficult because of time constraints, work, even before COVID, because the partner was probably overseas or something like that, then they may have to time the ovulation time the sexual intercourse around ovulation period. But of course, like we've mentioned earlier as well, the best time would be just to have regular sexual intercourse. And if you have a regular menses, like I've mentioned as well, if you have a 28-day cycle, then ovulation would be predicted to be about 14 days before your next menses cycle.
Miscarriages happen more often than we think. We do quote maybe 20% of pregnancies. Okay, and this will include natural pregnancies as well. They do miscarry, and the miscarriage rate is probably higher than we think because some people miscarry without even them knowing. And most of the time, the most common reason of miscarriage, or if the baby stopped growing at some point in time, will be due to chromosomal genetic abnormalities. Okay, meaning when the egg and the sperm meets together, the genetic combination was not ideal, and that leads to a arrest of the growth in pregnancy. But that doesn't mean that the couple has any genetic problems. It just happens by chance. So most of the time, pregnancies that miscarry happens sporadically, happens by chance, and most of the time they do not recur. So, but of course, there is 1% of the population with recurrent miscarriages. Okay, and for that, we'll quantify that by at least 2 or more miscarriages. And if that happens, there are investigations in terms of hormonal blood investigations, scans, for us to determine whether or not there's an underlying abnormality that results in recurrent miscarriages. But of course, for that, again, I will urge you to discuss with your gynecologist or your doctor to see whether such investigations are needed.
As you can imagine, if the man has a problem with erection, maintaining an erection, or difficulty in ejaculation, that would be a problem, and the causes of erectile dysfunction or ejaculatory disorders would be as common as like age, chronic diseases like diabetes, nerve issues, hormone issues, or even obesity. Of course, any previous surgeries to the genital region. And then we go on to the amount and the quality of the sperm. We look at a few sperm parameters, namely the concentration within 1 milliliter of ejaculate, and then also the motility, and of course morphology of how the sperm actually look like. And anything from again, chronic diseases like diabetes, obesity, hormonal problems can give rise to poor sperm quality. Treatment for male infertility or enhancement of male fertility can be as simple as improving your lifestyle, reducing your weight, making sure that you're not obese, making sure that you don't have any chronic diseases or your chronic diseases are well controlled, such as hypertension or diabetes. And also you must have a wide range of a healthy balanced diet, and also to make sure that the production of the sperm is not compromised. We're talking about supplements. And as a guy, you can initiate contact by coming to us at KKH Hospital or SGH or any of the tertiary hospitals that offer fertility treatment. And we will start by taking a full history, checking you out, making sure you don't have any of the chronic diseases. And then we will also proceed to do a sperm test to make sure that your sperm are healthy, alive, and active. And if there's a problem, we'll take it from there and we will help you with any problems that you have. Azoospermia is a condition whereby we find no sperm present in the ejaculate. So that is a problem that we see in some of our infertile males. And the causes of azoospermia, we can list it broadly into two categories: the problem of it being an obstructive problem or the problem of a production problem. So if it's an obstruction problem, actually we can go ahead and retrieve sperm surgically from the testis itself. Yes, it sounds like a very painful endeavor, but it is actually widely practiced, and we do it all the time here at KK and SGH, and we have successfully helped couples with azoospermia achieve pregnancy either through IUI or IVF with a surgically retrieved sperm. We get this a lot. So a lot of patients that come to us without the husband, saying that, oh, my husband is actually very fit, he's a marathon runner, and he cycles every day. I don't think there's going to be a problem with him, so I just want to check on my side. Actually, you can never tell what the sperm quality is until you do a sperm test. And of course, when the man is fit, the chances of him having chronic diseases like diabetes, high blood pressure, cholesterol, obesity is far less likely. However, there could be other issues such as, remember I told you about the hormonal problems, genetic issues, other type of chronic diseases like autoimmune diseases which does not manifest outwardly, and those could have a profound impact on the sperm. And so fertility is a couple's thing, and I don't think it rests solely on the shoulders of the woman to get themselves tested. So when there's a fertility problem, both should get tested and both should ensure that their parameters or their test or their condition is up to mark, so that going forward they'll know what to do. Well, I don't think the strength of the ejaculation affects, rather how much is coming out in that ejaculate. So I'm talking about, again, the volume of the ejaculate, the concentration, the number of sperm present, the number of healthy, good-looking, active sperm in that ejaculate. So how far the ejaculate goes, it doesn't matter, but it's really what is in the goods.
So one of the most common ones, for example, there can be tubal blockage, right? If there's a tube blockage either from one side or both sides, and the egg cannot meet the sperm, fertilization cannot take place. Or if there's any abnormalities in the uterus, all right, which causes disruption to this process, or if the ovary fails to release an egg, every month, which leads to end ovulation. And this can be represented by women having very irregular cycles. And of course, as what my colleague has mentioned just earlier, male factor or sperm issues that can also lead to infertility. And we can't disregard a very big part of fertility problems that's actually unexplained. So that actually occurs in 30% of couples, in which all the investigations may be normal, but they are unable to achieve a pregnancy. In terms of whether having menses twice a month will actually reduce your ovarian reserve, the answer is no, because having menses twice a month does not mean that you're actually ovulating twice a month. There could be an underlying abnormality that results in having irregular bleeding, and that is not due to ovulation. And most of the time, irregular bleeding is actually due to the fact that you're not ovulating, and hence the body doesn't have a signal to actually have regular cycles. So I would advise people who have irregular cycles to actually get some investigations done. So this is a problem that is not uncommon in our clinics, and it's probably underrepresented because some women may be embarrassed or shy to even talk about this problem to their friends or to their doctors. If you have vaginismus and you're unable to have successful penetrative intercourse, so do get help early, because of course we can do a physical examination to find out if there's any structural abnormalities, do a scan for you. And on top of that, there's actually sexual health clinic that's available in KK Women's and Children's Hospital. It's a multidisciplinary clinic whereby it's run by a gynecologist, the psychologist, and also physiotherapists that takes a multi-pronged approach to actually help you achieve successful intercourse. Because having vaginismus and difficult sexual intercourse are multifactorial. It can lie not just from physical side, can also be psychological, and sometimes just tense muscles that prevents you from having successful sexual intercourse. So most of the time, menstrual cramps are, I would say, you can say normal, okay, what we call primary dysmenorrhea referring to menstrual cramps. So primary dysmenorrhea means that there is no underlying abnormalities in the womb that will be causing such cramps. And this can be due to a physiological process whereby when there's a withdrawal of hormones, the blood vessels constrict in the womb, resulting in shedding of lining, and that will result in menses. And because of the constriction, release of certain proteins, and that will actually cause you cramps. However, for people who usually do not have menstrual cramps, or they have mild menstrual cramps, but then there was a recent change resulting in worsening severity and intensity of their menstrual cramps, there could suggest an underlying reason, for example, what we call adenomyosis, or thickening of the womb, endometriosis, or even fibroids. So if there's such a condition, you're experiencing sudden recent worsening of menstrual cramps, you can go to your gynecologist for a scan to find out if there's any underlying cause to it.
Generally, most doctors would recommend that the couple go straight on to do IVF if the couple has certain conditions. For example, if the woman has both tubes blocked, or if the man has a severe problem in the sperm. Doctors may also encourage the couple to go straight on to do IVF if the woman is of an older age, or if she's known to have a low egg count. And the reason is because as the woman becomes older, both the egg count as well as the egg quality would decline. So such women would actually have a shorter reproductive window to conceive. Other indications for IVF would be, for example, if the couple have tried artificial insemination or IUI and have not gotten pregnant. In January 2020, the government removed the age limit for IVF in Singapore. Prior to that, women were only allowed to do IVF if they were less than 45 years old. But from 2020, the government has lifted this age limit for couples to do IVF. So theoretically, in Singapore, you don't have to be of a certain age to be allowed to do IVF anymore. Generally, we would encourage couples to try fertility treatment as early as they can. because fertility, the success of natural as well as assisted conception do depend on the woman's age. So if you do your ART, either IUI or IVF in a restructured hospital like SGH, KK or NUH, you do get to have government co-funding for your assisted reproductive treatments. The reality is that the success rate for IVF is very much dependent on the age of the woman. Of course, there is a little bit of an association with the male age as well. But I would say that unfortunately for us women, we are on the losing end because the success rate does largely depend on the age of the woman. Generally, if the woman is closer to 30 than 40, in her early 30s, the success rate for one cycle of IVF would probably be about 40%. Once she reaches her mid-30s, the chances of getting pregnant with one cycle is about 30%. And once she's closer to 40 or in her 40s, it can go down to as low as about 10 to 20% per cycle. Vaginismus means that the woman has a problem with intercourse, and patients with vaginismus often suffer from very painful intercourse, such that it might not be possible for them to experience penetration. So IVF is certainly possible in women with vaginismus, and actually if husband has good sperm and the tubes are not blocked, these women can also consider IUI as well to get pregnant. Patients with chronic conditions such as diabetes and obesity do have a higher chance of experiencing difficulties with ovulation. So for these patients, they also do have a higher chance of having problems such as polycystic ovarian syndrome, which affects ovulation. So essentially, for such patients, we do recommend different varieties of treatments, and this can range from giving them medications to induce ovulation, like what Dr. Wong mentioned about clomiphene and letrozole. We can combine ovulation induction with IUI, and at the same time, they also have an option of doing IVF as well. So there are different options for patients with chronic medical conditions such as diabetes and women who are obese. Having said that, generally we would recommend that women with chronic medical conditions try to control these conditions before they embark on pregnancy, because these would actually impact on their obstetric risk if they do fall pregnant. So we like to optimize that before they actually start to get pregnant. Generally, after a fresh cycle, what happens is that your female hormones, the estrogen and progesterone hormones, are in very high levels. So if your fresh cycle didn't result in a pregnancy or didn't result in embryo transfer, generally we'll advise you to wait for about 2 months before you embark on your frozen cycle. And the reason for this is because we want all these high hormone levels to actually go down to a physiological level before you embark on your frozen cycle.
So the production of sperm is a really dynamic process. So you can have really poor sperm on certain days where you're not feeling well. You may be having a slight flu, you may be having a little bit of fever, you may be feeling stressed, and the production of sperm on that day may differ from what you have done before. So coming to COVID-19, I don't think COVID-19 itself has any effect on male fertility, but if during the course of COVID-19 and the guy has been affected more severely, having more symptoms like lung symptoms, breathing issues, chronic fever, these might all have an impact on the sperm quality and sperm production. But having said that, that again is a temporary response, and if enough time has lapsed since the main part of the infection and the guy has recovered fully, I would say it's okay. It's fine to proceed with the IUI, provided the original or the start state of the sperm quality has been good prior to the infection. So most of the people will really just recover back to baseline.